Hello again, this is Joyce, and today we will be discussing what you can do in the event of a lower back strain or sprain. Low back pain is commonly caused by damage to the soft tissues supporting the lower spine, including your muscles, tendons, and ligaments. The back, especially the lumbar or lower back, bears much of your body weight during walking, running, lifting, and other activities. Thus, sprain or strain to this area is very much common.
So what causes a back strain or sprain? Twisting or pulling a muscle or tendon can result in a strain. It can also be caused by a single instance of improper lifting technique or by overstressing the back muscles. A chronic long-term strain usually results from overuse after prolonged repetitive movement of the muscles and tendons. In addition, several factors can put a person at a greater risk for a back strain or sprain, including curving the lower back excessively, being overweight, having weak back or abdominal muscles, and or tight hamstring muscles in the back of the thighs. Playing sports that involve pushing and pulling such as weightlifting and football also increases the risk of a lower back injury. And what are the symptoms of a back strain or sprain? Each person may experience symptoms differently depending on your pain tolerance level and the severity of your injury. Even then, symptoms of a strain or sprain may include sudden pain that gets worse when you move, muscle cramping or spasms, which are sudden uncontrollable muscle contractions that results in more severe pain. Lower back area which feels sore to the touch, decreased function and or range of motion of the joint, such as difficulty walking, bending forward or sideways, or standing straight. And in some cases, you are encouraged to visit a doctor for further consultation if you feel a pop or tear at the time of the injury.
But the symptoms of a lower back strain or sprain may resemble other medical conditions or problems. So it's always best to talk to your healthcare provider for a diagnosis. While a pullback muscle or strain may seem like a minor injury, the resulting pain and muscle spasms can be surprisingly severe. When soft tissues in the lower back are stretched or torn, the surrounding area will typically become inflamed. Inflammation or local swelling is part of your body's natural response to injury, in which blood is rushed through the injured tissue in order to restore it. Inflamed muscles may spasm, feel tender to touch, or cramp and contract tightly, causing intense pain. So what can you do then to recover from this injury? As my colleague Jacqueline has described in the previous video on the first aid management for ankle sprain and strain, the management for lumbar strain or sprain are similar and can be separated into two phases. The goal of the first phase is to reduce the pain and spasm when you get sudden flare-ups. This may involve rest, the use of ice packs, and compression or pressure, especially for the first 24 to 48 hours after the injury.
For the first few days, apply an ice pack for 10 to 15 minutes to reduce swelling. After the first few days, try heat for 15 minutes at a time to relax your lower back muscles and ease pain. Never sleep on a heating pad and always protect your skin by placing a towel between your body and the ice or heat source. If you find the pain excruciating, you may also visit the nearest doctor or GP for prescriptions of non-steroidal anti-inflammatory drug to help reduce pain and swelling, for you to be able to move around easily. After the first 24 to 48 hours, you may begin to return to your normal activities as tolerated. You are encouraged to attempt to move around slowly, as extended bed rest or immobility simply prolongs the symptoms and delays your recovery. This is because reduction in activity can lead to weight gain, loss of bone density, reduce in your spinal joint mobility, loss of muscle strength and flexibility in other areas of your body.
The likelihood of a complete recovery after a lumbar strain or sprain is excellent. Most people with lumbar strain or sprain symptoms improve in about 2 weeks. More than 90% of patients completely recover from an episode of lumbar muscle strain or sprain within 1 month. However, if severe symptoms continue to persist for more than 2 weeks, additional treatments may be required. This is when you should visit your nearest physiotherapy center for further guidance and assistance with your injury. Low back strain may also develop into a chronic condition unless efforts are made to change the habits that contribute to the problem. Your physiotherapist will also provide you with tips and self-management like exercises that are helpful in preventing any re-injury or flare-ups.
Lower back stretching exercises are encouraged as it helps to maintain its flexibility and mobility. Do core strengthening exercises for your back and abdominal muscles to provide more spine stability in the long term as your pain eases further. Swimming, stationary biking, and brisk walking are good aerobic exercises that generally do not put extra stress on the back. Use correct lifting and moving techniques such as keeping the object close to your body and squatting to lift a heavy object. Do not twist around and bend at the waist to lift. Get help if an object is too heavy or awkward. Maintain a correct upright posture when sitting and standing. When sitting, keep your lower back supported. Use a roll-up towel as needed for more support. Quit smoking. Smoking is a risk factor for atherosclerosis, the hardening of the arteries, which can cause lower back pain and degenerative disc disorders, as it reduces the efficiency of your blood circulation. Avoid stressful situations, if possible, as this can cause muscle tension. And lastly, maintain a healthy weight, as extra weight, especially around the midsection, can put strain on the lower back. And now to sum all of this up into key points about lumbar strain. Lumbar refers to your lower back. Strain can cause damage to the tendons and muscles, causing pain and soreness. Non-surgical methods can cure most low back pain, and most importantly, contact your healthcare provider if symptoms do not get better over the next several days, or if symptoms get worse.
Well, that's it for this video, and I hope you have enjoyed and learned something new. If you would like to know more about other conditions or injuries and its management, please leave your comments below and we'll do our best to answer them. Also, if you find this video informative, please give it a thumbs up, share it, and subscribe to our channel for future updates. Once again, I'm Joyce from Remarkable Physiotherapy and Rehabilitation, and I hope to see you again in our next video.